Right, as Justine has just mentioned, my name's Hannah. I'm the network manager for involvement at York, which is the PPI Patient and Public Involvement Network at the University of York. You're probably wondering where Jenny is. So in the promotional sort of video that we put together last year, I had a counterpart, Jenny, but she has moved on to a new job at Northumbria University. So I'm afraid you've only got me today, but I'm going to be ably assisted by Chris. Chris, do you want to tell us a little bit about yourself?
Thanks, Hannah. Yeah, Chris Walker. I've been involved in patient involvement work for about 12 years now, starting with patient participation groups and gradually working my way up to the National Cancer Patient Forum and in the research side, which I've been starting to get involved in for the last sort of 2 or 3 years. And I want to know a few of you. Hannah, a while ago at Scott's Corner Hotel, who convinced me that patient public involvement in research could and would work, and that she was definitely the person to follow because her heart was in it. That's the big thing, is finding people whose heart is in what they're doing, because that so often isn't quite there. They think they know what they're doing and they're pretty good at it, but the heart isn't in it. Well, Hannah's heart's in it, so that's why I'm here today. And when she asked me if I'd be interested, I couldn't believe, Hannah Gray is asking me to work with her. So there you go. So now it's over to you, Hannah.
Thank you, Chris. That's extremely kind. I didn't know you were going to say that. It's rather thrown me off balance. Okay, so some housekeeping then. We're on Zoom, we're being recorded. If you've got any questions, please put them in the chat. And I know that Justine and colleagues from NIHR will perhaps be gathering those questions as we go. And if you have any tech problems, please alert Justine and colleagues from NIHR to those problems, and they'll be able to sort you out. I'm afraid I'm not running the Zoom show from back here. Okay, so what you can see here is the involvement at York Twitter handle and the Northern Cancer Voices Twitter handle, who Chris was one of the many organisations Chris is involved in. So if you'd like to follow us or have a closer look, feel free. Okay, so Justine has mentioned who Creating Connections are, so I can zip through this one. Justine, did you want to talk to this slide as well? Just provide a bit more information, or shall I zip past this one?
You can probably zip past it. We'll be able to, if you're happy, Hannah, we'll be able to make the slides available on Voice as well. It just shows the range of the different organisations who do research and do have patient public involvement engagement as part of their roles. So it's a lot of different people that are taking part in research of health and care. We cover the care sector now across the universities, the NHS, many different platforms that are part of the National Institute of Health Research as well. And of course, Hannah there from York, but we also work with Newcastle University quite a lot.
Thank you, Justine. So the aims of today's session are to help you identify and approach members of the public, patients, carers, service users, family members, friends, and to then help you prepare to engage them in meetings and being involved in research. And we're also going to cover a few do's and don'ts and some tips for effective patient and public involvement interactions. So how are we going to do this then? So the format and the content of today's session aims to give you practical steps to follow when considering how to identify, approach and engage public contributors for public involvement. These are gathered from my experience, from advice I've received and guidance that's available widely. So we're going to focus on those three aspects: identify, approach and engage, to help you organise this stage of the PPI preparation. And we're also going to look at what's available to support you and what the UK standards for patient and public involvement in research say. And I'll be using these as a handy checklist or framework for you to follow. I won't simply be giving you a list of organisations, groups or communities to contact. That would be doing the difficult work for you. But also it risks deluging those I name drop after the session, which wouldn't be good. Okay, so the UK standards for PPI in research, there are 6 of them. And for me, this lays the groundwork for what Chris and I are going to say later. They were introduced by Alison and Felicity's session last month, and I'm revisiting a couple of them for this session. So because the questions that they pose, as I said, can create a useful framework. So there are 6 of them. They were published in November 2019, and they are inclusive opportunities, making sure that you're offering opportunities that are accessible and that reach people and groups according to research needs, making sure that you're working together in a way that values all contributions and builds and sustains mutual respect and productive relationships. Support and learning is what you're doing, helping to offer and promote support and learning opportunities that can build confidence and skills within public involvement. Governance, making sure that you're involving the public in research management, regulation, leadership and decision making. And then communications, are you using plain language, well-timed and relevant communications as part of involvement plans and activities? And then we might see impact. Are you seeking to improve by identifying and sharing the differences that public involvement can make to research? So these standards are intended for guidance. They're not necessarily mandatory. However, I know that the NIHR does make reference to them when talking about public involvement within research projects and applications. These standards were widely consulted on before they were published in November 2019, and they were piloted. And those pilot sites have written up their experiences of implementing one or all of these standards. And it's worth looking at those pilot case studies for some inspiration if you're getting stuck. There's the website, should you need it. Okay, so this is an example. I've screen grabbed it from the standards website. And so this is the inclusive opportunities one, which we'll see a few times in this presentation. And as you can see here, there are a few questions that you can consider and use as the framework, but there'll be more on that later. So in my view, there's also a range of softer principles that you're committing to when you seek out, approach and engage patients and the public. And these include starting an active partnership. It's a relationship between you and your research team to conduct and produce research together. And in some cases, your research relies on the experience and health journey of public contributors' stories or their experiences, and they're choosing to share those stories and experiences with you. So be careful with them. Treat people with respect. Give them suitable notice of meetings and deadlines and keep them updated on project progress. You're committed to shared communications and understanding, which includes listening to people. Give PPI equal time and space on your meeting agendas. You're also aiming for an equal power balance wherever and however possible. For example, payment and time for time and contribution and not just expenses if possible. Meeting public contributors in their setting. Alison spoke last time of engaging new mothers with a mother and baby support group in the community, rather than expecting them to come new baby, buggy and all the gubbins onto a university campus or a hospital site, which would be completely unfamiliar to them perhaps. And be mindful of the commitments that of those who you wish to engage may have. Not everyone you will want to talk to will have a 9-to-5, and some will have caring responsibilities for which they'll need to find cover to attend your meetings, to be involved in your research. And finally, you're building a relationship with rapport and trust. Don't let people down. Chris, did you have any comments on this one?
Yeah, thanks. Yeah, particularly be careful with stories and experiences. People, when you get people to talk to, you will find them coming out with very heartfelt stories, and they will bring tears to your eyes. That's happened to me when people open up to you, and it's not when you go and ask them questions. It's when you get into a conversation with them. I think that's the sort of key message there. Don't go with a sheet of paper and ask them questions. Get into a conversation, and you'll get stories which are shatteringly effective and useful. Treat people with respect. I've been treated with the opposite of respect. I've been treated as just a sort of not even a number on a page. Somebody once said to me when I was at a meeting with the lead cancer nurse, "And just who are you?" Well, that kind of annoyed me a lot, but it wasn't so much for myself. It was because there I was with a lead cancer nurse, and somebody quite senior was saying, "And just who are you?" So, you know, I was kicked under the table at the time. And as we were going out at the meeting, the lead cancer nurse said to me, "Well, at least that person will be able to tick their box. That was a really unpleasant lesson for me. So, you know, there's an awful lot to be learned from reading between the lines of what Hannah has put up there. Equal power is another one that's very important. You know, you must, I wouldn't say emphasize, but demonstrate that the people you are working with have the same say as you do. And patients don't really expect that. The first time it happened to me, I was in a meeting with about 12 senior directors, and the National Cancer Director was in amongst them. She was brand new to the job, but there we were with the privilege of being in a meeting with the National Cancer Director. I was the only patient there, and felt a little bit out of it. And there was somebody pretty senior next to me who didn't want me there, who was kind of influencing the meeting. The National Cancer Director all of a sudden leaned round this chap who didn't want me there and said, "And what's your take on all this then, Chris?" I managed to get my brain into gear and say what I was preparing to say, but the fact that I was treated as an equal by the National Cancer Director in front of 12 very senior directors from the north of England, it just took my breath away. And after the meeting, I was trying to slide out the back door because I was pretty shattered at the experience. And the National Cancer Director broke away from all these other directors and came across to me and said, "Thanks for your contribution there, Chris. I'll see what I can do for you." That's how it can work with equal power.
Great, thank you, Chris. So let's move on to step one, identifying people to be involved in your research. Now, who you hear from matters. Who needs to be involved and when do they need to be involved? Think this through for every stage of the research process, including those earlier stages of understanding priority areas and developing the research questions if you're able. Doing this will give you time to build the contacts, build the trust that we've been talking about. It will give you the space to have the open discussions and also discuss with people and patients about ways that they would like to be involved. And it will provide an opportunity for you to explore research questions and methods for doing the research. Talk to your research team and the patient and public involvement engagement leads and managers and other colleagues, and they'll be able to help you map out who you need to talk to and help you think through what characteristics need to be considered. So things like age, gender, disease, illness, condition, diagnosis, and stages of those things, ethnicity and background. So what do the standards say? Identifying audiences for PPI corresponds with the Inclusive Opportunities Standard that I mentioned earlier. And the following questions that they have can help you meet the standard, and I think they'd aid your thinking. So ask yourself, have barriers to involvement such as payment for time or accessible locations for a meeting been addressed? How is the information about opportunities in your research? How are they shared, and do they appeal to different communities? Is there a fair and transparent process for involving the public in research, and do they reflect equality and diversity duties? Is there a choice and a flexibility in the opportunities offered to the public? Do you need to, in order to answer those questions, do you have the information you need, or do you need to read up on the latest guidance or advice from people, from specific centres or groups that you might need help with in identifying and approaching? And I'm thinking here of the focus at the moment around equality, diversity and inclusion. And there is the Centre for Ethnic Health Research, which can help, based in the East Midlands, which can certainly help with this and have some resources for researchers. And there's also things like the NIHR guides and examples that get published fairly frequently. And I'm thinking here of the Reach Out project, which engaged, particularly in Yorkshire and the Humber, with Gypsy and traveller communities. So yes, it's worth seeking out the guidance before you dive headlong in. Chris, any comments on identifying people?
Yeah, this is very, very important because there's a tendency to use the same people. There's a tendency to say, oh, we need patients for this project. Has anybody got any patients? And it's the same patients that come forward. Now, that's not the patient's fault. Or in some ways, the people who have been doing it's fault. That's just because that's the way it has always been done. And we found ourselves dealing mainly with secondary care up here in cancer service improvement work. And it was the National Cancer Patient Forum who suggested we try and get involved with primary care because they're a huge untapped resource of patients with opinions. And we kind of recognized this, but we hadn't done much about it until something happened up here where primary care was struggling to get transport for patients on a Sunday to a large hospital who had put on MRI scanners. And nobody had thought about the fact that there was no transport involved. Well, we just rang everybody we could think of and we sorted it out. But then we started to think about this and said, hang on, here's all these patients who had a problem and we managed to sort it out between ourselves up here. So you never know where you're going to find patients and how they can be very much involved. And the fact that we're pretty sure that there's huge numbers of patients in primary care who would love to be involved in the work we do, and I'm sure would love to be involved in research. So it's not using the group of people who you've always tended to use in the past, who are very often very knowledgeable and capable people, but there's many, many others. So don't just look at what you have done, look at what you can do.
Great. Okay, so moving on then, the second phase is approaching people. Where is everybody? Where do I find these people? So before you dive headlong in, think about who in your organization knows people. Are there access and outreach teams that you can talk to? Are there people that work regularly with clinical colleagues or teams in hospitals or in primary care, as Chris has just mentioned? More broadly, the NIHR Research and Design Service may be able to help you with this. They've often got links and contacts into local communities. And if you're a University of York academic or researcher, you can come and talk to me. So if thinking local, then who can you approach locally? There are health watch teams, there are user experience teams, there are the voluntary community and social enterprise organizations. There are patient participation groups in most GP surgeries these days. There are patient leaders, community leaders, and faith groups. However, I would urge that you make yourself culturally aware if you're going to approach faith groups, noting important religious days and festivals, and also non-religious days, just to ensure that any of your approaches don't clash or offend. On a national scale, then, there are national charities and campaign organisations who may have local or regional groups. It's worth noting here that some national organisations have their own research arms and fund research themselves into a condition or disease specific to them. So they may not be willing to let you approach their members. However, if you are being funded by one of these groups, do by all means talk to them about engaging with their members or patient advocates to get the views that you're after. And then, of course, lastly but not leastly, there are the national databases. So there's the NIHR People in Research, which is where researchers and academics can upload an opportunity to be involved in research, and people and patients who have signed up to the database will then get a notification of your that you're seeking people, and they'll get in touch with you that way. There's also Voice Global that Justin's mentioned at the University of Newcastle, and there's the smaller MQ database called Participate, which has a focus on mental health in particular. So you've identified people, you're starting to think about how you who you approach, and now we're going to sort of talk you through how you approach people. So practice being able to describe your research in 1 or 2 sentences that are jargon-free. Test it on family, friends, neighbours, colleagues in other departments. Be clear about the difference between involvement and participation, and be comfortable explaining that to public contributors. Often you'll find people who are new to being involved in research are very, very keen, but they might think that they're signing up to a trial, which would be participation, rather than a seat at the team table, which is involvement. So consider drafting an advert to use to promote your research and the opportunity to be involved. This could be a short summary, using the 2-sentence suggestion up earlier, and being clear about what involvement will involve, including the time commitment and if payment is available. If it isn't, I'd suggest this needs stating too. The advert can then be used in email communications, printed out and put up in community venues or similar. And then social media could also be used too, although you may wish to shorten your message in order to attract attention and then use the advert that you've drafted to share with people who express more interest. One example I have of this is in a recent exercise that the NIHR Bristol Biomedical Research Centre did. Mike Bell, their patient and public involvement facilitator, did just this. He invited their public contributors to help shape the centre's communication material, and the overwhelming response was less is more. So, this is the copy of the advert. Mike put this on Twitter, so it's available for all to see. And as you can see here, the information fits on one page, lots of white space, it's colourful and it's eye-catching. It contains the key information and gives details for people to get in touch if they want more information. When approaching groups and committees and communities, be honest and be clear. Be open to channels of engaging with people. So some may wish to meet you for coffee, some may wish to chat on the phone. A quick email exchange is enough, and be prepared to support and help people to join a video call, particularly in these sort of COVID times. Running a familiarization session on Zoom or Teams for people so that they get a handle on what the controls do, and run a dry run before the actual event. So time is your biggest factor here. Please make space for plenty of time to draft the communications, the adverts, the tweets, the emails to people that ultimately you don't know yet. And then ask others to screen it for you or read it to check it's clear and understandable. And then allow plenty of time for people to respond, to ask questions, to weigh it up against their current commitments. And go back to the standards that we've mentioned already around inclusive opportunities and communications. And just look at those questions again and check that you're on the right track. Chris, anything about approaching people that you wanted to add in here?
Well, no, just the main thing about keep it simple. We've just launched a new website, northerncancervoices.co.uk, that went live on Monday. And we spent a long time just making certain that it was simple. Because if you fill an advert with information, people might read it, they might not. So you've got to figure out what the basic message is, who you're trying to attract and why, and get it down to a one-liner, as simple as possible. It's going to hit them hard and get their attention, because people very quickly lose interest. So it's so important, keep it simple and then make it better once you start getting things to happen.
Great. Okay. So you've identified who you would like to involve. You've successfully approached them. You've secured an opportunity to talk to them about your research. And then comes making sure that that's engaging. This fits with the communication and working together standards. And the questions posed here, again, are helpful to prompt your thinking and set you off on a good path to work with public contributors. For example, the communication standards ask, are the needs of different people being met through inclusive and flexible communication methods? A process is in place to offer, gather, act on and share feedback with your contributors. And then the working together standard asks, again, around practical requirements and arrangements for working together. Have these all been addressed? Have all the potential ways of working together been explored? Is there a shared understanding of roles, responsibilities and expectations on both sides? Have you, the researcher, the academic, the clinician, outlined what public contributors can expect of you? And that comes back to the softer principles that we mentioned earlier. And have an individual's influence, ideas and contributions been recognised and addressed? So, ahead of a meeting, consider, is your research easy to understand? Have you put it in that easy to digest, simple, clear language? Does it have a glossary or a jargon buster if you really can't go without that heavy language? Think about how you might make your research relevant to everyday life. Do the people coming to the meeting understand the context and the purpose? Have you produced and circulated some materials in advance so that participants can feel prepared? It's a huge step for participants and public contributors to come to a meeting warmed up and ready to express their opinion or share their story. And what do people need to know before they attend? How will you structure the meeting? Will it be an open discussion? Will there be small groups or pairs discussing on their own and then reporting back? Do you have a checklist of questions that you'd like people to explore? What will the patient journey be like? And how will that patient experience, how will that then affect the patient experience or the family or carer experience? And what social, cultural, financial, physical, and emotional factors might influence your research? And then we're back to communication again. Work out how you will actively support your contributors, email, phone calls, social media, updates, manage expectations around what is feasible within the realms of research and the research cycle process. So you've done all this preparation and you're on the verge of meeting people. What can you achieve together in this meeting? So this is a selection of the things that you can achieve and you can do. Of course, it's not the entirety. So key questions that public contributors will have from their perspective might be, who will it affect and how will it affect them? What are the potential risks and the potential benefits to the patient and public involved in this research? And what do you know about the patient journey and the impact that the research will have upon this patient journey? And how will accessibility and diversity be addressed? Public contributors can help you or even draft a plain English summary with your direction. They can help with refining patient-facing materials such as information sheets, again, drafting jargon busters or glossaries. And then they can help you think about what will happen after the research. What impact will it have? How will patients, families, carers, and the public find out about the research results? So this is touching on the dissemination phase. Okay. So, Chris, any thoughts on engaging people?
Well, that's an interesting one, because we've spent the last 6 months engaging with people in the north of England to develop the cancer network, which is Northern Cancer Voices, and we have found a huge variation in responses depending upon the local environment. And it's not easy at all. You've got to see what the local people think, or it needn't necessarily be geographically local, but the people that you want to engage with, and don't ask them questions. Start a conversation off with them to find out how they think. That's much more important than thinking what questions you're going to ask these people. So it's a gradual process of finding out who the people are and what they respond to and how they can help you. And I certainly agree with Justine's comment about where it is appropriate or may not be appropriate to engage patients, because there will be times when it is not appropriate to engage patients. But there will be other times when the patients can be hugely important in saying to a researcher, what do you mean by that? Can you give us a plain English explanation of that? And I remember putting somebody on the spot by saying, can you give me a one-liner to describe that project? And I'm afraid it was with the University of York, but it did note the fact that that person did come back with a one-liner on that project. And I was happy after that, because I could understand exactly what that was. And it was how to modify behavior of people by talking to them. But the preparation for that was huge. So it took a while for me to understand, what was required there. So put some time into the planning, keep it simple, and come up with one-liners wherever you can. Use a facilitator, maybe, but it's a delicate balance between the people you want to engage with and how you, the professionals, are going to engage with them.
Thank you. So Chris and I have given you lots of things to think about here. You've given everything we've suggested your full consideration. Now comes to the planning of the meeting. You want people to feel comfortable and talk and engage with you. And this research is important to you. And after all, they're giving up their spare time. So here are some practical things to bear in mind when planning the event. Okay, so, sorry, there we go. Right, so plan the date, the time, and the duration with your public contributors in mind. What will work best for them? Working parents may not be able to speak until later in the evening after bedtime. Children and young people may not be available until weekends, which may be outside of your working hours. Make sure you establish a welcoming, respectful, kind environment. Encourage everyone to feel comfortable and able to join in. Make sure your meeting room has windows and natural light, for example. So create a comfortable environment, whether online or face-to-face, with refreshments and comfort breaks, or look at having it in a neutral community setting and set some ground rules. So such as including introductions, begin meetings, and consider icebreakers to build rapport and ease the atmosphere. Do your best to ensure that everybody has a turn to speak and to be heard. And as Chris has mentioned, if this is too much of a juggle with running the session as well, ask someone to step in and be the facilitator for you. Be open-minded and curious about the opportunity to learn and enjoy it from your public contributors. Explain the research process and the research cycle to ensure that everyone's clear on where you're going and what you're doing. Always thank people for their time and their input, even if it's in person. Follow it up with an email, and continue to communicate and keep in touch with attendees. So that's a lot of information that Chris and I have thrown at you, lots of practical stuff. What I want to do now is slow things down a bit and share something with you. It's a blog entry from Kate Horton, who is the Public Involvement Coordinator at the Institute of Mental Health in Nottingham. The blog's called Moving Forward Slowly and is Kate's reflections on patient and public involvement in COVID times. And it's with her permission that I'm allowed to share some extracts with you today. So Kate says, I know my ease is not the same for everyone else. Equipment, bandwidth, knowledge, and confidence have been the main difficulties that I've seen others encounter. I might spend a week preparing for a meeting. The attendees of my meeting that I am organised for might spend less so. Someone might be at home, someone might be homeschooling or caring for a family member. They might be worrying about something or someone far away that no amount of worrying can alleviate because they can't go and see them. They might have always existed in this juggled space, as many public contributors do, but it's just that we see it more now. Kate goes on to say, I believe the experience we've all had in the last year or more is the experience that public contributors have always had. We now know more acutely what it feels for that email to drop at 6:30 in the evening when you're prizing a games console off a teenager or watering the tomatoes or about to take the dog for a walk. For meetings, catch-ups and gatherings, I know that if I rattle through content on the assumption that everyone has the same access, attention span or perception, it will put me in dangerous territory with the relationships in that space. It sets me on the road of assumptions. Some assumptions can be positive, but most are negative and are framed by our own perceptions and positions. And I know that rebuilding a relationship is a lot harder than maintaining one. I wanted to share that with you because the insight that Kate has managed to gather there for what it's like for the public contributors on the other side just really sort of struck a chord with me. Chris, have you got any reflections on what it's been like as a public contributor involved in research during COVID times?
Yeah, it's rapidly getting better. When I first got involved with research, it was sort of okay. But over the last year, particularly, things have changed an awful lot in the way that organizations have approached us. And, you know, I see it in the PAN group that Christy Shenton has started up in the north of England, that I'm part of, and also Justine Smith's side of things. One of my other hats is a research champion along with Mary, who's in the audience there. So I've seen things rapidly getting better because they've had to. And the way that patients have been involved in a meaningful way has been dramatically improved. When you get serious senior people coming to a group of patients, and this actually happened, national cancer directors came to the patient forum and said, will you help us? And we've got obviously said, yes, how? Just tell us, we'll help you. And that started to happen on the research side as well, because I was in a COVID research panel And that was the same way. We were very, very much part of what was going on. And one of the delightful experiences there was Newcastle MIC did a presentation, and it was about Christmas time last year. And the slides were so good, I said, you know, can I have a copy of the slides? And the researcher who would be presenting it, or the person who would be presenting it, she was off on Christmas leave. And I thought, well, that's it. But lo and behold, two or 3 hours later, I got this response back from the researcher, or the person who did given the delivery. So here's the slides. You know, that just took my breath away of how things have rapidly improved in the research side with COVID.
Thank you. I promise we're drawing to a close, but before we do, we wanted to share some tips with you. There we go. Right. So, where the danger of assumption. And I'm going to give you a hypothetical here now. Our research is looking at diabetes and its risks to health. Obesity can increase the risk of getting type 2 diabetes. Let's talk to a local diabetes support group. While the logics here in the medical and health perspective may be true, think about it. To approach a diabetes support group and ask them immediately about obesity is something that some members of that group might find insulting. And so you've immediately sort of destroyed that relationship that you'll have to start building again. So just check your assumptions before you engage and approach people. Beware the burden of representing everyone. Again, another hypothetical. We have a couple of patient reps that we talk to, so that's the PPI done. It's very unlikely that 2 individual public contributors can represent the vast experiences of everyone that your research is about or will impact. Good practice suggests a minimum of 3 people. This allows for a sharing of the burden of PPI activity and responsibility, but it also allows for a diversity of opinion and a social aspect for those 3 individuals who may not be academics, researchers, university or hospital staff. And when in meetings, that can be quite isolating. And lastly, avoid tokenism and treating PPI like a tick box exercise. This is one of the biggest criticisms of PPI, that it's tokenistic. We know that PPI is fast becoming a compulsory part of research applications. And so it can seem like another box that needs ticking simply to get the application over the line. One way to address this has recently been published by Dr. Dawn Richards, a Canadian researcher, and the musculoskeletal patients involved in her research. This article is called Tokenism, Seeing It, Fixing It, Perspectives from IMHA Patient Partners. And this table shows an example. So what Dr. Richards and her team of and her patients, partners, public contributors in the UK have done here is set out 6 different scenarios. And the scenario is in the blue column on the left, and then you've got potential solution for the public contributor, the patient partner, in the yellow. And then what to do if you're a member of that research team and you see this happening is there in the green column. I'm not going through all 6 scenarios, don't worry, just scenario 1 here. So the situation is you as a member of the public or a patient have been asked to join a grant application just a few days before the deadline. Your role's not well defined and it feels like you're being asked because the grant call requires a patient on the team. And you're concerned that the invitation's not genuine and instead it's an opportunity to tick a box. So what Dr. Richards and her team suggest for the patient or the public contributor is it is okay to tell them you're not able to be part of this application. It's okay to turn them down. If the situation doesn't feel right to you, even if you think the research is important, if you do feel like you would like to be part of the team, make suggestions about your proposed role on the team and see if there's an openness here to have that discussion. If you're a member of the research team and you see this happening, think about engaging patients earlier in the idea generation and the research questions start of the project, as we mentioned right at the beginning. And this would be well in advance of your application deadline. See how they'd like to be involved meaningfully. Otherwise, you might have to prepare to learn that you're too close to the deadline for a patient or a public contributor to accept to be part of your team. Right then, so we have come to the end. Sorry, I wanted to ask Chris if he had any thoughts on tokenism.
Oh, definitely, but you don't want to hear them. There's so much, many of us who have had experience of tokenism, and it's an awful shame, because that's what's caused the problem, or the situation now is, in the past, researchers have been, or not just researchers, but in the service improvement side of things, it has been very much a tokenistic approach, and we're trying to get away from that now, because we know that it can work extraordinarily well. So unfortunately, you know, everybody's paying the price now of tokenism in the past. So it's a gradual process, but we're getting there. But you know, be prepared for it.
Thank you. Okay, so we've come to the end, and just before we finish, I wanted to recap on what we've talked to you about today. So, using the UK standards for PPI in research as a framework, as a tick list for what you need to think about and do as you begin the path of identifying, approaching, and engaging public contributors. We also discussed some of the softer principles that you're inadvertently committing to when you approach and engage potential public contributors to be involved in your research. We've urged you to be honest and open, see it as a relationship to build trust and rapport. Use existing links in your organisations, use contacts, go to where the people are, and beware assumptions, the burden of representation, and tokenism. Thank you.